Hello, my name is Michael Wind, and I am a orthopedic surgeon here at Ortho Virginia, specializing in hip and knee replacement surgery. And wanted to talk to you today a little bit about knee replacement and the SubV knee, and how the SubV knee can allow for minimally invasive knee replacement surgery with quicker return to activity and less pain. So knee arthritis is a condition involving the loss of cartilage in the knee joint. The cartilage breaks down, resulting in inflammation and pain. This is a debilitating condition that can rob patients of their abilities to participate in the activities that they normally enjoy. Knee replacement surgery is performed by removing just small amounts of bone on the end of the femur and the tibia and replacing it with metal and plastic, thereby allowing for metal to rub on plastic and as opposed to bone on bone. Our goal for surgery is less pain, better function, the ability to participate in normal activities without knee pain. However, in order to perform this procedure, the knee must be exposed surgically. And the question is, how do we do that? And this is where the SubV knee comes in. The traditional knee replacement is performed through what's called a medial parapatellar arthrotomy. In this case, an incision is made over the skin and dissection is carried down to the deep tissues of the knee. At this level, the surgeon would encounter the quadriceps tendon as well as the kneecap here in the front of the knee, or the patella, and there's significant muscle on both sides of the quadriceps tendon. The traditional method to expose the knee is called a medial parapatellar approach, where an incision is made through the quadriceps tendon and around the patella, and the muscle, the vastus medialis, is split off from the tendon in order to create an opening to expose the knee and place the implants. What makes the SubV knee different is the anatomic approach that is performed to expose the knee. SubV stands for SubVastus, and what this approach does is it allows exposure of the knee by coming underneath the vastus musculature without any incision through any muscle or through the quadriceps tendon. The incision in a SubV knee would come through this area alongside the patellar tendon and then curve medially or towards the inside underneath the vastus musculature. The surgeon would then mobilize the muscle and mobilize the tendon such that the entire muscle and tendon can slide to the side without any damage at all, allowing for exposure of the knee and placement of the implants. At the conclusion of the case, the entire quadriceps muscle as well as the tendon come back into place and are able to function relatively normally quickly after surgery due to the fact that there's been no cutting of the muscle or the tendon. In a traditional medial parapatellar approach, this incision through the tendon is sutured closed at the conclusion of the case. However, when the patient bends their knee, you can see that there's significant pulling through that area where the suture line would be, resulting in pain. Also, by going through the muscle and the tendon, there is difficulty, usually with strength, for a period of time after surgery. Whereas if the muscle and tendon are left completely intact, the muscle, the quadriceps muscle and the tendon can function relatively normally very quickly after surgery. I think that the SubV knee is the most minimally invasive way to perform knee replacement. I feel that I've seen in my patients better strength after surgery, less pain, better range of motion, and quicker return to the activities they enjoy, expedited recovery after surgery. I've been very impressed with this procedure over the time that I've been watching patients with it, and I think it really allows for rapid return to recovery in the most minimally invasive way to perform knee replacement surgery. Thank you very much.